A Doc SIBO and Max Studio Productions presentation. How SIBO can cause diarrhea and constipation. Part 1. SIBO, or Small Intestinal Bacterial Overgrowth, happens when there is an unusual growth in the small intestine's quantity and variety of bacteria. This overgrowth can interfere with typical digestive functions, resulting in symptoms like diarrhea and constipation. How can SIBO lead to diarrhea? 1. Bacterial fermentation. SIBO can cause an excessive fermentation of undigested carbohydrates. This produces excessive amounts of gas, including hydrogen and methane due to bacteria overgrowth. The increase of these substances can irritate the intestinal lining, leading to diarrhea. Additionally, excessive gas and irritation in the small intestine can affect gut motility, the coordinated contractions of the intestinal muscles that move food and waste through the digestive system. Abnormal gut motility can speed up stool transit time through the intestines, reducing the time for water absorption, and resulting in looser and more frequent bowel movements. SIBO can disrupt the normal movement of food and waste in the gut, affecting motility. This can cause various symptoms, such as indigestion, malabsorption of nutrients, increased gas production, and water secretion. These factors can collectively contribute to the development of chronic diarrhea. The solution to SIBO is to be tested, implement dietary modifications, antimicrobial therapy, and other interventions. This can help restore gut motility and improve digestive function, reducing the frequency and severity of diarrhea episodes. 2. Malabsorption and osmotic diarrhea. An overgrowth of bacteria in the small intestine can interfere with nutrient absorption, specifically carbohydrates. When these carbohydrates are not properly absorbed, they can cause diarrhea by drawing excess water into the intestines. The fermentation of these unabsorbed carbohydrates in the colon also creates an osmotic effect, further increasing the water content in the stool, and leading to diarrhea. This happens because water moves across cell membranes to balance solute concentration on both sides. The resulting excess water softens the stool and causes diarrhea. In other words, in diarrhea, unabsorbed substances draw too much water into the intestines, making the stool loose and watery. 3. Bile acid deconjugation. Bile acids are necessary to digest fats. Bile acids play a crucial role in the digestive process as essential components of bile, a fluid produced by the liver and stored in the gallbladder. They assist in emulsifying fats, breaking them down into smaller particles, which allows for better absorption by the body. Bile acids usually get absorbed and recycled effectively in a process called enterohepatic circulation. But with SIBO, the excess bacteria in the small intestine can mess up this recycling process. The enterohepatic circulation is a continuous cycle where bile acids are recycled between the liver and the small intestine, to aid in fat digestion. Bile acids, crucial for digesting fats, are produced in the liver and stored in the gallbladder until needed. When we eat fatty meals, the gallbladder releases bile into the small intestine, helping break down fats for absorption. Most bile acids are then reabsorbed into the bloodstream and transported back to the liver for storage. This cycle continues, ensuring efficient fat digestion. However, with SIBO, this essential process can be disrupted. Bacteria overgrowth in the small intestine may alter bile acids, reducing their effectiveness in fat digestion, and causing malabsorption. This can lead to gastrointestinal symptoms like diarrhea. Additionally, excessive bacterial fermentation of unabsorbed fat in the large intestine can further contribute to digestive disturbances. Bacteria in the small intestine can deconjugate bile acids, breaking them down into their components, and making them less effective in emulsifying fats. This results in less fat absorption and an excess of unabsorbed fat in the large intestine, leading to gastrointestinal symptoms such as bloating, flatulence, distension, diarrhea, and urgency. It is often misdiagnosed as IBD or IBS diarrhea. Patients with chronic watery diarrhea should be tested for SIBO and bile salt malabsorption if suspected. Suppose you suspect that you may have bile acid malabsorption. In that case, it's important to consult with a healthcare professional to discuss your symptoms and consider appropriate testing and treatment options. One test that can diagnose bile acid malabsorption is the SIBO, selenium homocholic acid taurine, test, also known as the bile acid absorption test. During this test, a radioactive substance called SIBO is ingested, and the body's absorption of it is measured through a series of scans over several days. This test evaluates how well the body reabsorbs bile acids in the terminal ileum, the last section of the small intestine, and reflects the efficiency of bile acid recycling in the enterohepatic circulation. Suppose the SIBO test indicates that bile acid malabsorption is present. In that case, it can help diagnose the condition and differentiate it from other gastrointestinal disorders with similar symptoms, such as SIBO. Treatment options can then be tailored to address the underlying cause and improve the management of the condition. 4. Increased intestinal permeability. Inflammation due to SIBO can harm the intestinal lining, leading to a leaky gut or increased gut permeability. The small intestine is protected by a barrier that controls nutrient absorption, and prevents harmful substances like bacteria and toxins from entering the bloodstream. SIBO can damage the tight junctions between intestinal cells and disrupt this barrier. Tight junctions are like gatekeepers, regulating the passage of substances into the bloodstream. When damaged, the gut lining becomes more permeable, allowing larger molecules and harmful bacteria to escape into the bloodstream. This triggers an immune response which then can cause inflammation in the gut lining. This inflammation can further harm the tight junctions and increase the leaky gut. Consequently, inflammatory molecules and bacterial byproducts can escape into the bloodstream, activating the immune system and causing systemic inflammation. A leaky gut enables harmful substances to enter the bloodstream, leading to various symptoms and health problems, including autoimmune conditions, systemic inflammation, and digestive issues like diarrhea. Let's review. Due to various mechanisms, SIBO can cause diarrhea and constipation. In the case of diarrhea, SIBO leads to excessive fermentation of undigested carbohydrates by the overgrowth of bacteria in the small intestine. This process produces gases such as hydrogen and methane, which irritate the intestinal lining and affect gut motility. Abnormal gut motility speeds up stool transit time, reducing water absorption, and resulting in loose and frequent bowel movements. Unabsorbed carbohydrates in the colon also create an osmotic effect, drawing water into the intestines and softening the stool, leading to further diarrhea. Moreover, SIBO interferes with nutrient absorption, especially fats, due to bile acid deconjugation by some bacteria in the small intestine. Deconjugated bile acids are less effective in digesting fats, leading to reduced fat absorption. Unabsorbed fat reaching the large intestine interacts with gut bacteria, producing fatty acids and byproducts through fermentation. These byproducts can create an osmotic effect, drawing more water into the colon, contributing to diarrhea. Additionally, they increase gas production, leading to bloating, flatulence, and gut distension. SIBO-induced inflammation can also damage the intestinal lining, causing increased gut permeability or a leaky gut. This allows harmful substances, such as bacterial byproducts and inflammatory molecules, to enter the bloodstream, triggering immune responses and systemic inflammation. These inflammatory molecules can further contribute to diarrhea and other digestive disturbances. To manage SIBO effectively, it's important to make dietary changes, undergo antimicrobial therapy, and try other interventions that restore gut health, regulate motility, and address the root causes of diarrhea. For optimal outcomes, seeking guidance from a healthcare practitioner specializing in managing SIBO is crucial. This will help alleviate symptoms and enhance digestive health. Thanks for watching.